Hey everybody, this is Kevin with Nursing KAMP.com, and I'm going to go over an exercise that I do with my students, especially as they're preparing for the NCLEX. It's called the Symptomology Exercise, where we explore the symptomology that we see in questions and that we'll see in practice. So let's get into it. Okay, Symptomology Exercise. What is it? Why do we do it? Well, the big thing about the Symptomology Exercise is that when you have NCLEX questions, you're going to have symptoms in the question. And what I've been doing with this exercise is I've been doing it for the past couple of years, and I've been finding out that when you look at NCLEX questions, all NCLEX questions will have symptoms in them. And if they have symptoms in them, you need to be aware of the symptoms. However, if we are looking at just, studying content and in nursing school and such like that, you might study specific content that is not necessarily symptom ready. Like, for example, if you're looking at hypokalemia, and in a previous video I talked about what hypokalemia is. It's all slow-like symptoms, right? So except for urinary output and heart rate. Well, that's good to know. However, you're still going to have questions and more symptoms. So this exercise is available on nursingkamp.com and for download, and this is what you do to work through it. Okay, critically thinking on symptomology. This is the main sheet, and the primary focus of this sheet is to isolate each of the parts of the symptoms. And the first section we're going to look at is the primary system. So whatever we're looking at, we need to know, what's the most likely. Now, for example, substernal chest pain is specific to cardiac. Right? So where epigastric pain could be cardiac, but it could also be GI. So when we're looking at symptomology, this gives you the opportunity to isolate what the symptom is and try to figure out what the primary area is. The next thing is to look at the conceptual focus. So if you're looking at something like substernal chest pain, right, which is an MI, myocardial infarction, well, is that oxygen related? Is it perfusion related? Is it a safety related problem or a higher Maslow problem? Now, a higher Maslow is pretty simple because higher Maslow means generally teaching. So the Maslow teaching would be if you have a person who has stable angina, they would need to know when they have substernal angina or substernal chest pain. That's acute, and they either need to take nitro, call 911, or seek medical help at that point. And so that's why the higher Maslow piece comes into there, because so we always should be teaching about these symptoms with patients with chronic conditions. Okay, the last part is when we're looking at acuity rating. And when we're looking at this acuity rating, it's basically stating, there's 5 different things that you need to think about with this symptom. So when we're just talking about substernal chest pain, well, that would get an acuity rating of a 1. And the reason it gets a 1 is because you stay in the room. You're not going to be like, oh, you got substernal chest pain, I'll talk to you later. No, you'll deal with the problem now. Then you will do the next step, right? So generally it would be assess that pain, give nitro if nitro is advised, and go from there, notify doctor. So number 2 is intervention needed, and number 3 is assess the patient, gather more data. Okay, so what does that mean? Well, if you're looking at somebody has abdominal pain, okay, well, would you assess to find out what's going on with that abdominal pain, or would you just do an intervention? For example, an intervention might be medicate with pain medication. Okay, so if you have, the patient's presenting with abdominal pain and you're like, I'll just medicate him with morphine. It doesn't make any sense. Like, they just told you they had pain. Why would you medicate them with morphine? Well, it says that, let's figure out what's going on. So assessment would be needed. So gather more data. And then you would anticipate based on that data whether a medication might be ordered. And then number 5 would be non-urgent. Okay, so a non-urgent thing could be anything from chronic pain or something like that requires teaching. All right, so then the main complication in 3 words or less. So whatever the symptom is, so chest pain, right? So substernal chest pain, the main complication would be myocardial infarction, right? And look at other symptoms, right? So if it's just substernal chest pain, is it myocardial infarction? Okay, so we have to say to ourselves, well, patient with a history of CAD and substernal chest pain, well, myocardial infarction. Patient with a history of stable angina has substernal chest pain, myocardial infarction. A patient has a history of chronic renal disease, substernal chest pain, that's not myocardial infarction. Let's look at what else is going on. So this would need an assessment, because that symptomology doesn't go back with this sheet and back behind me, where we were talking previously about knowing what the precipitating factor is, what the main complication is, the content, and then what the complication is. For an example, we used in a video, we talked about the main thing that we're talking about is a DVT. Right? So the precipitating factor would be calf pain, right? Warm erythemia. And then the main complication is, over here, main complication is pulmonary embolism. All right, so how many symptoms do we have? Well, we have a lot, and that's the big thing about this exercise. It's a moment to really look at all these symptoms right here, because these will show up in NCLEX questions. And so you have to be familiar with this because they're tested on this. So when somebody has diarrhea, right, do you stay in the room or do you assess? You assess that patient. So, because diarrhea, you're not just going to go give them an antiemetic, right, or something like that. So let's move on down. So you have a lot of symptoms to go through, and then we have I put together a sheet here, so there's more symptoms, and this is the sheet. Now, this sheet is basically defined into 3 different parts, and those 3 different parts are here. So when you have abdominal distension right here, your first step is to say, what is the primary symptom, right? Or the system that's responsible for that. Well, can you say abdominal distension is pulmonary? No, it doesn't make any sense. It's not related to that. Okay, so is it cardiac abdominal distension? Maybe CHF, but not most likely, right? So if you think maybe, or you're kind of like on the fence about it, it probably is not. It should be at a level where you just understand what it is, and that's what you're looking for. I got a cat over here. So, all right, so the next thing is abdominal distension. Is it a renal symptom? Okay, well, renal patients with peritoneal dialysis could have abdominal distension. Chronic renal disease, like acute kidney injury? No. All right. How about endocrine? Yes, endocrine, liver disease would have abdominal distension. Okay, so that's kind of what we're doing. Just verbally going through it and thinking critically about this thing. So whether or not, so if I don't know this, right, and I'm like, I need to look this up a little bit, put a minus there, and I keep on studying that content in relationship to content. So that's the first thing, right? So abdominal distension, you need to identify what the primary system is or specialty's involvement with it. Okay, so then concept. Is abdominal distension oxygen related? All right. Well, it depends on the condition, right? So if it's liver disease, yes, they're going to have ascites. They're not going to be able to breathe as well. So there'll be a problem with oxygen there. So therefore, they would need to be taught turn, cough, deep, breathe. All right. How about perfusion? Not necessarily. Is it safety related? Well, that's a good question. It depends on what the issue is, right? Is it abdominal distension? If a patient is post-op and they have abdominal distension, it requires some assessment. Is it bleeding? Is it not? So safety related depends on the context. Okay, higher Maslow, requiring education. Well, if it's a liver disease, I'm going to teach them to turn, cough, deep, breathe, and take deep breaths. That would make sense. Okay, so now acuity rating. Okay. Do I stay in the room and notify the doctor because I have abdominal distension? Well, depends on the context. Patient who's post-op, right? H&H is low and has abdominal distension. Yeah, call the doctor. That's how this starts to work. What is the relationship of these symptoms with a question? And what this is going to do is it's going to really start to make you think about each of these things. Now, the good thing about this, and pretty much everything I do in my course in a nursing camp is purposeful work. It's not stuff that is busy work. This is to get you thinking about, listen, if the NCLEX can only give you symptoms in a question, these are the symptoms, and this is where they come from. And where did I get the symptoms? Well, I got them from a book, right? I mean, where it was all symptomology, and it was based on the assessment. And I basically took all these in and put them into a list. And now I use them in my class, because a lot of times what happens is that if you're looking at this and you're looking at anhydrosis and you're like, I don't know what that is, right? Well, it gets a minus, and then you look it up, because this is what will happen. If you're on the NCLEX and you're taking a test question and you see that, the question is, what is it? So you have difficulty answering that question. And what this does is it limits that process. It makes it not as prevalent in not knowing the information. And that's the purpose of this exercise and this assignment. And what you do is you print it out and you just basically work through it. And then another thing to do is that all these symptoms right here will show up in different areas. So that's the basic gist of it. I mean, like I said, it's a good exercise to do before the NCLEX to kind of go through it. If you are in nursing school, every symptom that you're going to come across and every condition that you're going to have from your burn list is going to have these symptoms in here. And it's a good method to kind of start to isolate these and say that this goes with this, right? So you'll start to see things that are transcribed all over. If you have a headache, right? A headache can go anywhere. So it doesn't really mean, it all depends on the context. Now, if you have somebody who has hypertension and has a headache, that's stroke, right? Precipitating factor, hypertension, risk factor, stroke. So if they are presenting with hypertension and have a headache, assessment neural checks, find out what's going on with that person, get their blood pressure, do assessment, and so on. So we keep on moving through, and these are all these different things, and it's an exercise. It's purely for you getting your brain around symptomology and you utilizing and becoming familiar with all these terms. So my name is Kevin, and this is Nursing KAMP.com, and this is my symptomology exercise in order to further expand your knowledge of symptoms and the NCLEX. So I'll see you on the next time, and we'll see you in the next video.